She's right. We saved the best for last, so I hope we can inject some energy into the room. That's right, totally unbiased here. So I just have to say that I love this meeting every year, and the people in this room, the people who dedicate their lives to building these organizations are just such a motivation for me, and I know for so many people out in the world, as well as the scientists who work on our diseases. And it's especially poignant and really impactful that so many of us in the room are here because of, you know, the curveball that fate has thrown us. And I just want to tip my hat to, I think everybody in this room is amazing and has our own success stories in our own way. But somehow we had to pick 3 for this final session. And so it's my pleasure to introduce our 3 panelists for today. Monica Weldon is the President, Chief Executive Officer, and founder of Bridge the Gap SYNGAP Education and Research Foundation. She began her work in advocacy following diagnosis of one of her twin sons with the SYNGAP1 gene mutation, which causes symptoms including developmental delay and intellectual disability. She's an author, public speaker, and consultant who advocates for rare disease legislation at federal and state levels. Our second panelist will, in the order of presentation, is Dr. John Porter, who has more than 2 decades of experience working with federal and nonprofit organizations and with drug discovery and development companies. For 10 years, he worked at the National Institutes of Health, where he managed research grant funding that included diseases affecting the neuromuscular junction, nerve, and skeletal muscle. Dr. Porter also is a key member of the Interagency Muscular Dystrophy Coordinating Committee that guided research on all forms of muscular dystrophy. And finally, Terry Klein is President and Chief Executive Officer at the National MPS Society, an advocacy and research group for awareness of and research on inherited metabolic diseases, including mucopolysaccharidosis and mucolipidosis. She has an extensive background in national and international funds development in the nonprofit sector. Her youngest daughter suffers from mucolipidosis type 3. And the way we're going to run this is they're each going to take about 7 minutes to tell you their stories, their success stories. And then we had discussed it and pulled out some common themes across the stories, but we really invite you all to kind of take notes and join with us at the end to identify some of the common themes across the different success stories. And with that, I turn it over to Monica.
This is on, okay. Oh. Hi, I want to thank everybody for being here, and I want to thank the Nonprofit Forum and the NINDS and the Institute for inviting me to speak. It is really an honor to be here. Well, I'm Monica Weldon, and I just want to give you a little tidbit of my journey and how much we have done in such a very short period of time, and it's been a lot of help with the stakeholders in the space of especially rare disease, the National Institutes of Health, and of course federal agencies and things that we work with. But I just want to give you a little overview about our organization. We are a very young organization. Our mission is to serve, educate, and fund research for families coping with the effects of the SYNGAP mutations. We were established in 2014. We are now about 4.5 years old. We will be celebrating 5 years, September 14th of this year. We have 1 employee, and we actually have 7 executive board members. I forgot to count myself in that number. So we have 7, and we have 9 scientific advisors as well that are all experts in the SYNGAP mutation all over the world. I tried to put together some high-level points of things that we've discovered about the disorder since my son was diagnosed. He was actually number 6 in the world that we know of in 2012. And since that time in 2009, and I'll get to the next slide to kind of tell you that story, is we know now that the prevalence, our new prevalence numbers have come out that are 5 out of every 500 epilepsy encephalopathies will have a SYNGAP1 mutation. Intellectual disability ranges from mild to severe. They have a multitude of epilepsies. Actually, 85% of our population, though, falls within the absence seizures, and they can be combined with other seizures as well. 97 to 100% of all the SYNGAP1 patients will probably end up having an epileptic diagnosis. We have several, because of the nature of the disorder, we have many kids that go missed. My son actually, for instance, missed 5 years having epilepsy, and we did not know. It is one of the second most common single gene mutations linked to autism worldwide. And in recent publications that we found with our natural history data and some of the data that came out of our new database, we were able to find the sensory processing issue problem in this disorder in the frontal cortex of the brain, kind of by accident. And so that's a story in itself. But I wanted to kind of highlight how advocacy organizations can really pursue and accelerate research in an orderly fashion when you have several different things I guess, running in parallel to each other, I guess. I kind of want to go into the history of what the SYNGAP story is, because it's relatively new in comparison to many diseases that were discovered long ago. Of course, the gene was discovered, co-discovered by Dr. Richard Huguenier and Mary Kennedy in 1998. And then the gene was actually found in humans, first identified in humans, causing intellectual disability in 2009 by Dr. Jacques Michaud out of the University of Montreal. My son happened to be one of the first, of course, diagnosed in 2012, and I started the very first organization in the world to start trying to drive research in this disorder, and because there was nothing, and I knew there had to be something more. And I was bound and determined mother and was not going to stop until I had some answers. We then planned our first international meeting, and this was the first time in the world that we gathered every expert on SYNGAP1 who had heard of SYNGAP1 and even crossover disorders that were linked to it, and we all came into one room with 25 families from 10 different countries, and that changed the paradigm of the research. And since that meeting was in November of 2016, that's been about 2.5 years, and that one meeting set the ball into motion, and it has snowballed ever since. And so I'm hoping that the things that we do will encourage you as you run your nonprofits to do the same thing. Because since 2016, that same year, we launched our database, and our database is held by the National Organization of Rare Disorders and is in partnership with the FDA. And I have to say, that database has been our life-saving answer to finding out how this disease works and where we need to go to targeted therapies. I can't say enough about having a natural history. And I have to, honestly, I'm going to give Megan O'Boyle a shout out, because I had this conversation with her about 3 years ago, and she said, the first thing you need to do is get you a database. And I said, I'm on it. And you follow successful people. When you follow successful people, you become successful. So as we went on, we were able to, with the data from our database, find the mechanism of sensory processing. And also, we were able to devise with our community online and social media to have the largest cohort of individuals to help identify 2 brand new types of seizures in this disorder, plus find a biomarker that we're still going to be working on trying to validate, of course, the clinicians doing that. So that is our brief history, and I'm hoping next year I can't fit it all on one slide and I'll have 2 or 3. But I wanted to share with you the power of advocacy groups, because numbers speak volumes, and this is only public funding. And I said, well, I actually brought this slide to Congress, and I said, you know, I advocate using this information to show that we need incentives, but also it shows our progress. It shows the importance of our work. And, you know, I didn't raise that money. There's no way in the world I could raise that kind of money with less than 250 patients in the world to get that kind of information. It was our data, and it was the patient group behind this and being available to give us the data through our database, which with our letters of support and our preliminary data, like Geraldine was saying in the panel before, give that information to help support those grants that your researchers are applying for, to show that there's plausible evidence behind their theories. And when you do, you're going to win the money. I mean, there's just no question that you need as much support. And we started out, and as you can see, the numbers kept rising after the organization was established. Another thing that's great for researchers is publications. So these are all of the publications through just SYNGAP1 over the years as we have increased our advocacy efforts to try and find out what this gene does and how it affects other things around it. And so I kind of put down on the little history of where our markers were and the things that we did in parallel to where those things happened in the space of time. And that what you do as an advocacy organization in planning your events, incentivizing things, parallel, look at it all together, and then you can see progress being made. So I just wanted to kind of put that together, and I hope I did not go over my 7 minutes, because you might have to get that stage hook after me. But I just wanted to share with you a little bit of our history, and that my motto is you can't ever stop. People depend on you, and I made a commitment to do this, and I'm never stopping, because we're making progress, and our community is going to be better for it. And not only our community, but what we're finding out about our gene is going to affect the other things that hang out around it, like the SHANK3 with the Phelan-McDermott, Fragile X. You've got Angelman syndrome. I could go down the list right now of all of these other neurodegenerative or neurodevelopmental disorders, and how this information is going to fit into a puzzle piece that is going to help someone else along the way. So I thank you, and I am grateful for you letting me share today.
Infamous clicker. So I'm a bit of an odd duck at this meeting. I'm not actually representing a specific organization here. I've been involved in a number of things. I was in academia, as was said by Susan, for 20-some years, and then I was a program director here at NINDS for 10. And then I worked in patient advocacy full-time for 3 years, and I'm currently retired. It's really good, but I'm still consulting with a number of groups. So to the second bullet, as I say, I'm not representing a specific group, but I've interacted with a number of groups. So I was on Cure SMA's board during a really critical time with the approval of Spinraza and what they've been able to do with that. I've done a workshop and some other work with the FSH Society. I was employed by the Myotonic Dystrophy Foundation for a while, and I'm still consulting on a pretty regular basis with them. And I worked with Parent Project Muscular Dystrophy for a while after getting out of NINDS, after first leaving here. So I can't give you much background on the neuromuscular diseases that I've worked with, because it's a pretty broad spectrum, other than just say that these are typically serious, monogenetic for the most part, although there's some really odd things like myotonic dystrophy.